This video will be about COPD. COPD stands for Chronic Obstructive Pulmonary Disease. One way that I try to remember what COPD entails is I change the O to out of, and you will see why. We should recognize that when it comes to respiratory diseases, there are restrictive diseases and then there are obstructive diseases. COPD falls under the category of obstructive disease, along with asthma and this one. In addition, COPD is an umbrella term that includes the two following diseases, emphysema and chronic bronchitis. We all know that we inhale and that we exhale. Patients with COPD have difficulty with exhaling. We'll start with emphysema. To understand emphysema, we had to know about lung anatomy, specifically the alveoli, these grape-looking structures. As we see in this picture, from mouth and nostrils, air travels down our throat through our trachea and into our bronchi, and then into the alveoli. The alveoli are where the body trades carbon dioxide, generating the body for oxygen found in the air. In emphysema, the walls between the alveoli break down and end up forming larger but fewer alveoli. The trouble with this is twofold. First, there's less surface on the alveoli for gas exchange to happen. Second, these larger alveoli are less elastic. Try taking a deep breath and hold it. You'll find after holding your breath for a few seconds and then relaxing, your lungs will pull your chest back to normal size like a rubber band. For memory, think of normal, healthy alveoli like a balloon, and damaged alveoli found in emphysema like a grocery bag. Now that we know what emphysema is, the next question is, how do people get it? To learn how people get emphysema, we need to learn that our respiratory tracts do their best to remove pollution from the lungs. The trachea have to filter pollution before it reaches the lungs. If any pollution reaches the lungs, then white blood cells will eat the pollution, causing inflammation. Normally, inflammation isn't a problem because the body has chemicals to reduce inflammation. Overall, the body has a great cleanup system. So where does emphysema come into all of this? When there is far more inflammation caused by the white blood cells in the lungs, then there are chemicals to clean up the inflammation. So what kind of situation does this occur in? Smoking. When people smoke, there is far more pollution entering the lungs than the body can handle. This results in a lot of inflammation. Eventually, a lot of damaged alveoli in response to the inflammation. One thing I want to touch upon is that there are people out there who do live to their 80s, 90s, and even 100s who have smoked most of their lives. This can be attributed to genetics. There is a genetic disease called alpha-1 antitrypsin deficiency. Long story short, it results in the body having less capability of cleaning up the inflammation in the lungs. Therefore, these individuals are more likely to have emphysema from smoking. Since the lungs have a tougher time squeezing back to their normal shape, they end up stretching and becoming larger. We can see on this X-ray, on the left side, a healthy person. On the right side, we see someone with emphysema. Someone who has emphysema can have something called barrel chest, where the length from back to front is increased. Now let's talk about chronic bronchitis. Before air reaches the alveoli, it travels through the trachea and then into the bronchi. Rather than coffee filters, our respiratory tract uses mucus to prevent pollution from entering the lungs. Mucus can be found in our bronchi, and its job is to catch pollution. If there's more pollution, then the body will have to make more mucus to catch it. The problem with that is that there is so much mucus that the body has a difficult time getting oxygen into the lungs and carbon dioxide out of the lungs. Let's discuss what the signs and symptoms are of someone who has COPD. The number one sign will be that the patient has a history of smoking. Usually it takes at least 20 years of smoking and about half a pack a day, which comes to 10 cigarettes. But everyone's genes are different. In addition, the patient will say they feel short of breath with light exercise and that they have been coughing up mucus. Now let's compare and contrast the signs and symptoms of emphysema and chronic bronchitis. In emphysema, the patients will purse their lips. The reason involves physics, and I'll leave it at that. But to experience it yourself, try blowing as much air as you can, and you'll find that you will purse your lips. In chronic bronchitis, the patient will say they're coughing up a lot of mucus. Because of all the mucus, patients with chronic bronchitis have a harder time initially than patients with emphysema to get oxygen. If the body doesn't get enough oxygen, then the body will turn blue, and this is known as cyanosis. With emphysema, you will experience decreased breath sounds when listened via a stethoscope, and if you tap on the patient's lungs, you'll hear hyperresonance, which kind of sounds like when you tap on a drum. For bronchitis, you'll hear crackles, wheezes, and rhonchi. Kind of imagine a clogged up flute. Cor pulmonale means right-sided heart failure. Before saying how this happens, I'll talk a little bit about how the lungs work. The heart pumps blood to the lungs. The arteries that go to the different parts of the lungs will change size depending on how much oxygen is available at that part. If there's less oxygen, then the artery shrinks in diameter. This is a good thing because we want blood to go to areas of the lung that have oxygen for it to pick up. The problem is that with COPD, many parts of the lung don't have sufficient oxygen, and so many of the arteries will shrink. Pumping fluid through a small pipe is hard. What happens is that the right side of the heart, which is responsible for getting blood to the lung, will become buff. For a list of reasons, a buff heart does a bad job moving fluid, thus resulting in right-sided heart failure, otherwise known as cor pulmonale. Comparing emphysema and chronic bronchitis, initially, chronic bronchitis is worse than emphysema because none of the alveoli will have sufficient oxygen due to the mucus blocking transfer of the gases. But in emphysema, as it worsens, more and more alveoli will be damaged and cor pulmonale will develop. Alright, lab work and imaging. Remember that patients will have difficulty exhaling, and with spirometry, we can see how fast and how much a patient is able to exhale from their mouth. Arterial blood gases. We want to measure the amount of oxygen, carbon dioxide, and bicarbonate in the patient's body, as well as the patient's pH. This information tells us about how well a person is delivering oxygen into their body and carbon dioxide out. These measurements will be worse in a patient with chronic bronchitis because the gases are being prevented from coming in and out of the body. Chest x-rays aren't needed for diagnosing COPD. Rather, the chest x-rays would be done to check for other diseases that have similar signs and symptoms as COPD, such as pneumonia. And recall that with emphysema, their lungs will increase in size, resulting in a barrel chest. Treatment. The problem in COPD is that, again, patients will have difficulty exhaling. Therefore, the treatment involves making exhaling easier. There are two groups of medications used, and they both make the bronchi bigger. One are the beta-adrenergic agonists, such as an albuterol inhaler. The other are the antimuscarinic agents, such as an ipratropium inhaler. Some of you may have seen people with oxygen tanks with them. These oxygen tanks are increasing the amount of oxygen in the air that patients are breathing. Not every patient with COPD needs oxygen. Some of you may have seen this kind of screen with a bunch of numbers on it. One of the numbers is a measurement of oxygen in the body. If a patient's oxygen is less than 88%, then the patient will need oxygen. And last but certainly not least, try your best to quit smoking. Thank you for watching.